Welcome to the Dr. Berkson's Best Health Radio Show. And I know a lot of people say they're excited about their guests, but I am really excited about our guest today. We have on the show Dr. Norm Shealy. He is one of the most influential, and I mean this, top medical neurosurgeons who has changed the way we look at pain medicine, how energy plays a role into it. And even though he started out as a straight neurosurgeon, he has embraced mystical medicine and medical intuition. So we have an exciting show. We're going to talk about pain, what energy has to do with disease, and we're even going to talk about what past lives have to do with present illness that's not responding to cogent efforts. And what's exciting is that Dr. Norm Shealy, right now this month, is an anniversary of the 40-year-ago time that he was a diplomate founder of the American Holistic Medical Association. Now, I had a real conflict because there's so much I could tell you about him, but I also don't want to take up the precious time that we have with him. So I'm going to introduce him, say a few things, and then I'm going to give you a little bit more background, and then we're going to dive into this really important show. And one of the reasons is when he and I were chatting on the phone before the show, there's so many patients these days who are doing everything right, but still suffering. And we're going to talk about why that is and answers for this. So hi, Norm. Welcome to the show.
Great. Good morning. Wonderful to be with you.
So we met a number of years ago when you gave a 40-hour continuing education course at your university in Missouri, and for 40 hours you taught nurse practitioners, chiropractors, internists. Dr. Jerry Block came along with me and gifted me that 40-hour course, and you were so energetic and so dynamic. 40 hours you taught this course on your own, and you say that a big part of the reason that you're in your, I don't know if you want to share your age, that you've had the amazing career, and at the age you are, you're still contributing to medicine. You say part of that's due to not eating carbs, keeping your nutrition and hormones together, and having your energy and your past life agendas all cleaned up.
All of the above, and I don't mind sharing my age. It's 85, but I still feel 26.
You look like you're 29. I'm going to give you a few more years on that. And I remember, so you were a neurosurgeon. You graduated from Duke University. You entered med school at 19 years old, and you have a lot of incredible awards that are straight medical awards, one of them being that you're known for inventing the TENS unit for pain. And you had at that conference all of the different generations of the TENS unit, and you described that at the time you graduated, the main way to treat pain was surgery. But you didn't want to do that on your dad that was having pain. So a chiropractor had invented this unit that a naturopathic doctor shared with you, and then you took it to another level, and lo and behold, you invented an energetic way to deal with pain. And you had all those units there for us to look at.
And now I've got several more different.
That's what we're going to dive into in the show. Definitely. Let me just go a little bit more about your background because it's pretty incredible. And then we have all kinds of questions to ask you. You had observed when you graduated as a neurosurgeon that the most common symptom in the world is pain, but nobody at that time was specializing in it. And I think, so do you want to tell your story of how you went from being trained as a surgical interventionist to deal with pain to using things that were outside the box?
Well, basically, I was so appalled at the cutting of the spinal cord with a piece of a razor blade. That was how we did cordotomies in those days, that I spent several years doing animal research on how can I relieve pain at an electrical basis. And when I introduced my concept, both of TENS and spinal cord stimulation, the neurosurgeons in the room screamed and yelled, "You're an idiot. You know what you're talking about. It's only in animals." 3 years later, when I gave my first 6 patients that were successful, every neurosurgeon in the room wanted to do it. And last November, I was in Switzerland at the Swiss Pain Congress, And this is still being used all over the world. And it's even used more in Europe than it is here.
Now, what is it exactly that's being used?
Spinal cord stimulation, as well as TENS. Both.
And what exactly is that for people who are out there taking a walk listening to this podcast?
Well, initially, we actually had to operate and remove the bone over the back part of the spine in 2 levels. And then we could sew into the dura overlying the spinal cord an electrode. Today, we put it in through a needle. And so we can insert an electrode right through a needle in the lumbar spine and thread it all the way up to the top. And in fact, last March, we celebrated the 50th anniversary of my first dorsal column or spinal cord stimulator up at one of the big hospitals here. And I did my first one in many years.
So you've treated over a 30-year period at your clinic over 30,000 chronically ill patients. You started the first and only wing on a hospital that dealt with depression, pain, and obesity by treating energy. You have 9 U.S. patents. You've developed the TENS machine. You've developed the unit we've just talked about. And that's kind of straight allopathic intervention. But then you broadened to the bigger picture and you developed medical intuition as a diagnostic tool. So we're going to want to dive into that in just a little bit. And you trained several very famous medical intuitives like Carolyn Meese, who is an iconic heroine of mine. I love when I was diagnosed with breast cancer, she let me go into her home in Chicago, where we're both from, and really sat with me and gave me a medical intuitive reading. You founded the Holos Institute of Health, which is a nonprofit organization for research and education. You've developed the Shealy RelaxMate, the most successful adjunct for relaxation. You've developed 4 natural ways to increase a vital hormone, DHEA, dehydroandroepisterone in the body. You've developed advanced computerized traction table for treatment of headaches and back pain. You've demonstrated that transdermal application of magnesium is more effective than taking it orally. And I use your Shealy magnesium lotion all the time and recommend it for patients. It's available on Amazon and from yourself. You've got a newsletter that we're going to put in the show notes where people can get a link to your newsletter. You co-founded with Carolyn Meese, the American Board for Scientific Medical Intuition. And you even are very active in donating large amounts of money to a PhD program of psychology. You talked about that when I was in Missouri with you, to ensure that it would embrace not only psychology, but nutrition and spirituality. And so you are a mover and a shaker. So can you explain what medical intuition is, how you got to it, and how you use it with neurosurgery pain management?
Well, basically, when I was in undergraduate school at college, I was asked to interview Dr. J.B. Ryan, the first professor of parapsychology at a university. And I produced a radio. In those days, we didn't have television, by the way. I produced a radio show on Duke Radio on parapsychology. It started off with the rolling of the dice and stuff like that. And what I kept wondering is, why doesn't somebody do something useful instead of rolling dice and guessing numbers? And so in 1973, I actually was consulting with a Fortune 500 company, and they wanted to keep me, so they gave me a grant to study, quote, psychic diagnosis. And I interviewed 75 street psychics, so to speak, and found 5 of them who was 70 to 75% accurate, whereas chance was only 10%. And that was the beginning of when I went to publish it, I called it medical intuition instead of psychic intuition.
So you coined the term medical intuition. And,
yes.
And what does that mean to you for someone that's listening?
It means being able to make a diagnosis, not that there's something wrong with a part of the body, but exactly what is wrong. In other words, what is the physiological, the biochemical, the physical cause of the problem?
I see. So tell me, we were talking before the show started about the issue that so many people today do a lot of things right, but there's so much more illness and children are so much more ill. And, what does that have to do from a medical intuition point of view? What is the cause of all this suffering?
Well, the cause, to a great extent, is the fact that 80% of the food sold in this country today is junk. Our food industry is as evil as the pharmacomafia and the tobacco industry. And so, in addition, we are bombarded in the atmosphere and even in our rain with Roundup, one of the most poisonous substances ever devised in history. 65% of rain over the country has Roundup in it, and it's a horrible metabolic poison.
Oh my goodness. You were saying while we were chatting that evil is ignorance. And it's hard to understand that those people that are doing these things, their children, their grandchildren, are going to be vulnerable to the legacy that they're leaving also.
In a sense, all evil is ignorant, because ignorance violates a spiritual principle. There's only one purpose in being here, to help other people. And if you do anything that damages other people, that is true sin.
Can you tell me, now you had a hospital wing, an entire hospital wing that used energy medicine, energy interventions for pain and depression. That wing, I understand, as you were sharing it when I was taking your course, was open for about 30 years. Can you explain what that was and give maybe some of the most surprising case histories?
Well, there's so many of them. I suppose the first miracle that I noticed was a woman who was sent to me by air ambulance from Los Angeles to La Crosse, Wisconsin, where I was at the time, dying. Literally, they told her she had 2 months to live, a month. Well, they told her she had 3 months to live, a month before she came to see me. She couldn't get out of bed. She had to be put in a wheelchair or on a stretcher. On the 17th day of working with her, I did a 20-minute exercise on forgiveness. And this woman who had not been out of her wheelchair or bed got up and walked out of the room free of pain. Her cancer was gone within the next 3 months, never to return. I mean, that's the first big one that I saw. And I've had people with brain tumors that are incurable cure themselves using the mind. Often I have to do a past life therapy because I believe that all major illnesses are the result of unfinished business from a previous incarnation. In other words, if you die sometime in the past with anger, guilt, anxiety, or depression, anything that reminds you of that at some subtle level can bring on the same problem again. And so I've done hundreds of past life therapy sessions to help people get well. My favorite one there is a woman who was paralyzed from a gunshot wound through the abdomen. She gave a history that she had shot herself accidentally while cleaning her husband's gun. But when I did the past life, she gave an absolute perfect history of being Anne Boleyn, Henry VIII's wife, right up to the falling of the guillotine and her head rolling. And she was amnesic for the whole situation. And so I played back the tape of it to her. We didn't have CDs in those days. And she still didn't know. She didn't remember what she said. She was totally amnesic. I said, well, you just told me you think your husband shot you. She said, the last thing I remember is we were fighting, but I was told when I woke up that I shot myself accidentally. So she divorced her husband and got over her pain, at least, but not her paralysis, and started working in a pain clinic as a social worker.
So when I was at that class with you, you said past lives are so important in our present life illness that every single town should have a past life therapist. So can you explain what a past life therapist is, and even for people out there, what past lives are and your viewpoint of life, the tapestry
Yes.
of it?
No question about it. My first personal past life experience was in 1972. I saw myself as a physician in Egypt 3,000 years ago during a cholera epidemic. And that gave me an understanding of this whole concept that, that was a good life for me. It had no unfinished business, but it also reminded me that I had a purpose in this life to bring it back into reality.
So so you believe, and I believe also, but I don't know if all religions or people believe this, that life is a series of different incarnations, and we learn
Yes.
from those incarnations to serve each other. Can you share a little bit more of that bigger picture?
Yes, I know personally 30 of my past lives. 3 of them were pretty awful. I don't like to talk about those 3. I mean, in other words, I have been an evil person in 1 or 2 lives. And, I don't know how I could have done that, but it was a long time ago. But all my other lives that I know about, I've been doing what we're here to do, to help other people. Now, the important thing is to have a purpose. But remember, the person who made this computer is just as important as you and I are.
Exactly.
The person who made the desk that's sitting on is just as important, because I can't do those things, and I don't want to do those things. And I'm grateful that people will, there are things I don't like to do, so I can do what I do. And so if you're doing anything, if you're cleaning the building, you're just as important as a neurosurgeon.
So everybody has a purpose.
Exactly.
But not everybody feels it. So many people are struggling for their sense of purpose.
Well, there are several reasons for that. One of them is a lack of feeling loved, accepted, and nurtured as a child. If for whatever reason, in the first 7 years and 9 months of life, you did not feel accepted, or if in the first 7 years after birth, you had a major trauma, it blocks your ability to feel okay about yourself, self-esteem.
Why is it so difficult for parents and people to feel, to connect, to truly connect and be aware and give love? What is that? And it's an angst of humanity.
Well, again, it's that feeling of being unwanted. Remember, 40% of children in this country are born out of wedlock. Those kids have a very high incidence of being born prematurely. And, their life is virtually going to be ruined from the day of conception because they weren't wanted. And they don't get the oxytocin from the mother during the 9 months of pregnancy. But even if the pregnancy was desirable, if there's a divorce of the parents or a major trauma, then, especially in the first 7 years of life, I would say a majority of my patients were either abused or neglected as children.
So basically,
they'll tell you that.
So if you have this sense of not having authentic connection early on, it affects in some way your hypothalamic pituitary axis, and it really affects your future life. So how does one go about healing family of origin pain and suffering?
Well, there are 2 ways. One is past life therapy, and the other is to stimulate your ability to make oxytocin.
Oh, boy, it's interesting that this talk is going to oxytocin, because that's one of my favorite hormones now, and I lecture on it quite a bit at continuing education credit courses for physicians, pharmacists, nurse practitioners. Everyone's interested in this because it's the hormone of connection. Exactly.
It is the bonding hormone, the nurturing hormone, the love hormone, the essential to, I'm okay.
What's so interesting is that endocrine disruptors, I wrote one of the very first books on that, hormone deception, about 23 years ago. And we think of endocrine disruptors as disrupting estrogen or testosterone. But we now know that oxytocin can be disrupted by bisphenol A, the lining in cans, and it's just as much vulnerable to our toxic planet as all our other hormones are.
No question about it. In fact, every known disease, from diabetes to heart disease to depression, every known disease is associated with a low level of oxytocin. There's one exception, by the way. A narcissistic psychopath, they run high levels of oxytocin. They're in love with themselves over everything else in the world. But all other, even schizophrenia and all the things, are all associated with low levels of oxytocin.
So how do you boost oxytocin in a patient?
Well, I stimulate 13 specific points in the acupuncture system called the ring of air. And it takes 30 seconds to do it with air bliss. 30 seconds.
And the air bliss is the oil?
It is the oil, and you just put it into the point and move on to the next. 30 seconds, the whole body.
So you have put together a program of using essential oils and acupressure points to help balance and optimize hormones and health in the body.
Exactly.
What's the name of this program? Because you taught this at that 40-hour
Well, I
class.
call it transcutaneous acupuncture.
Okay, transcutaneous acupuncture.
Right. I've done acupuncture itself since the 50s, but I've started out, in fact, I created the term electroacupuncture back in the 50s.
You did? That was you? So you created medical intuition. You really were one of the first people to talk about holistic medicine, which is now called functional medicine. And now so you're just a pioneer on so many levels. And we're going to get into in the show some of your new things, which you were hinting to me before the show started, that are pretty exciting too. So stay tuned.
But interestingly, for instance, the other hormone you mentioned earlier, dehydroepiandrosterone, DHEA, is deficient also in every known disease. And DHEA is an antidote to stress. The average person peaks in making DHEA at age 25. By age 40, most people are already down 10 or 20%. By age 80, the average person has 10% of what they had at age 30. And so low DHEA is a remarkably important thing, and taking DHEA by mouth does not balance it. You have to make it in your own body. If you take it, it can raise the risk of breast or ovarian or prostate cancer. But if your body makes it, you never essentially make too much.
So you have invented 4 ways to boost your body's own production of this important hormone. In fact, there's a scientist in France named Dr. Fabre, and he's called the father of DHEA, and he claims DHEA really helps keep us well. And you've invented 4 ways for us to help our own bodies produce it safely.
Right. The first one, by the way, is an extremely important one. The first one I discovered was natural progesterone cream. As you know, at menopause, women essentially stop making progesterone. But progesterone is equally important in men for protecting, among other things, the prostate gland. So almost everyone at some point in time is going to need natural progesterone. My first study was with 12 men who were highly deficient in DHEA. And I gave them natural progesterone cream for 3 months.
How much? How much do you give to a man?
They need about 30 milligrams a day. Women could do up to 60. And basically, it's the cream. Don't take it by mouth. That's a waste of trouble. It damages the liver. But putting it through the skin.
I might have to contest with you, but we'll get into that in a few minutes about the oral. Okay.
All the men became horny, and everybody was happy except one wife. But the DHEA came up 60%.
So progesterone, topical progesterone, boosts our own production called endogenous production of DHEA.
Exactly.
Wow.
The second one.
And you were testing them pre and post and then getting their symptoms too. So you had this, you shared that with us. You were testing their levels before they started, after they started, and then how they felt. Okay. Now, the
second one was actually a combination of vitamin C and MSM, methylsulfonylmethane. C alone will not do it. MSM alone will not do it. But when you put 2,000 milligrams of vitamin C with 1,000 milligrams of MSM, it will raise DHEA an average of 60%. The third one was...
How much MSM do you take?
1,000 milligrams. Now, I put it into a combination. One of my patents is this one. The combination is vitamin C, 2,000 milligrams, and MSM 1,000 with 60 micrograms of molybdenum and 3 milligrams of beta-1,3 glucan. That combination is wonderful for everybody as an adult.
What's the name of it, and can we get that from you?
Dr. Shealy's Youth Formula.
I'm going to buy that today. And we're going to put a link for that on the show notes on my website so people can gain access to this, because molybdenum is not in most multi-minerals, and it's so important to help us process toxicity out of ourselves. So that's one of the ways that keeps us youthful. Okay, so so you patented that formula.
Oh, yeah. That's
not
actually, I just applied today for my 13th patent.
What's that one on?
This one is on adrenoscalar, our combination of sapphire and scalar energy. This is one of the two most important things I've ever done.
Okay, well, we'll finish with the DHEA, but then we're going to have to go to one of the two most important things you've ever done because you've done so much.
And then, of course, the Ring of Fire. And so Fire Bliss raises DHEA.
That's an essential oil,
well,
right?
It's another essential oil that you put on 12 specific acupuncture points, yes. And it's good for migraine, it's good for depression, it's good for back pain, it's good for diabetic neuropathy. I mean, it's a toss-up between fire and air as to which is the most important. They're all important.
So can somebody contact your website and order these oils and also get a way to know how to apply them on those 12 acupressure points?
Yes, they come with photographs, color photographs that show you where the points are.
Okay.
And so these four ways of raising DHE are critically important. But there's another aspect of these rings, these 5 rings that I call the sacred rings, by the way.
And the rings are the acupressure points in a certain pattern. Is that what you're referring to? Okay.
Fire, air, then there's water. Water raises and balances aldosterone, which is important for congestion and edema and swelling and things like that. Then there's earth.
Just one question. So few people even consider aldosterone. We think of cortisol for the adrenal hormone. We don't think of aldosterone, which the middle of the adrenal hormone makes. And aldosterone has so much to do with energy. And Dr. Wright's done a whole study about how in men it helps keep your hearing, the sense of hearing that can diminish as you age. It's an important hormone that most people don't talk about.
Oh, its core is emotional balance.
Oh, I didn't know that. Oh.
And so it can be good for high blood pressure. Again, it has different feelings. And then there's earth. Earth is critical because it raises calcitonin. Calcitonin keeps your bones strong, keeps you from developing or reverses osteoporosis. And it is stronger than morphine in reducing pain.
Calcitonin is stronger than morphine in reducing pain. And you have a set of essential oils applied to a specific acupressure points that helps our own body. That's what your work is doing with these things. It's helping our own body raise these hormones.
You bet.
So what's the name of that ring if someone went to your site for pain?
Ring of Earth.
Ring of Earth. Okay. Might want you to summarize these rings again because they're really important.
And finally, the Ring of Crystal. And, instead of metal, which Chinese cosmology might use, my guide said, no, we're really much more crystalline than we are metallic. And so it reduces free radicals a striking 80%. There's nothing that comes close to reducing free radicals as well as the Ring of Crystal.
Now, how did you prove, what were you testing pre and post when you originally were doing this to assess the level of free radicals in the body?
You can measure them in the urine. It's the easiest way. It's very simple. There's a urine test called Oxytocin, OXI-DATA. And 80% reduction occurs within 30 days.
Of using these points in essential oils.
Right. Actually, you'll reduce them 40% within 2 weeks. To get the optimal, it takes a month. Because you're talking about total body metabolism here. And so this helps you keep regenerating. Remember, every cell in your body dies and is replaced within a maximum of 7 years. Many of them much shorter than that. And so this assists in the regeneration of every cell in your body. And if you do a combination of fire, earth, and crystal, just those 3, it will rejuvenate your telomeres 3.5% a year instead of shrinking 1% a year.
Well, boy, you take a look at you. You're 85. You have so much dynamic energy. You never yawned once in the 40 hours that you were teaching us, even in the later afternoon when most people have a little bit of energy waning. I remember commenting to Dr. Block, you didn't even yawn once. You were always filled with energy because you do these things, as well as you say you avoid carbs, right?
Yes, that's right. I think fruits, if you eat whole fruits, they're fine. But other than that, most other carbs are not good.
Yeah, I remember that. So you were just commenting, your guide said something to you. And I know a few people were going, what? What does he mean by that?
My latest book is Conversations with G, a physician's encounter with heaven. And actually, for the first time publicly, I've gone into great detail about having an angelic guide that I call G for guide.
That's interesting. In India, they use G as a term of respect for someone they hold. So they go, Hunji, Hunji, yes, G, and they bless and go, that's interesting.
Exactly. But basically, interestingly, I was over in Holland and I had an image of a copper pyramid, for instance. This is about 20 some odd years ago. And I got back to my room and I drew this image of the copper pyramid with crystals at the top. And I didn't know what it was about. And then a day later, my guy says, Norman, where do you think that image you got yesterday came from? I said, I thought it was mine. He said, I put it there. You're supposed to do research on it. And he didn't give me anything else. But I knew what to do then. That's when I created the idea of putting human DNA frequency electrically into the copper pyramid. And that was the beginning of my work on rejuvenating telomeres. We demonstrated that if you sat in that copper pyramid for 30 minutes, 5 days a week, your telomeres would regrow instead of shrinking. But most people didn't want a copper pyramid in their house. And so I then created a mattress out of it. So it's a mattress you put on top of your bed. And it's got a copper screen on it with a pound of crushed sapphire crystal. It's called the Rejuva Matrix. And if you will turn that on while you sleep, put it on a timer, and give it 1 hour every night while you're sleeping, that alone will rejuvenate your telomeres 3.5%. You don't have to do anything else.
So now can we purchase that from your site?
That is also on my website, yes, Rejuva Matrix.
How much does that cost? I got a California king bed. It's pretty big. I'm not sure I have to put it on the whole thing, though. I'm single.
That's the most expensive one that I've done because of what it's made of. It's like $4,400.
Okay, I think I'm going to have to buy that, Norm. I'm going to have to go on your site and get my credit card out.
But the alternative is to do the three rings.
Right.
With the oils, or the one we are going to talk about sooner or later, adrenomedullin, sapphire, adrenomedullin scalar.
Okay, we'll go into that in a minute. I just want to go back to the guide for a second. So you are really an amazing person. You start out as a neurosurgeon. You make incredible patents and inroads into straight neurosurgery as a field. And then you start seeing a bigger picture of energy and mysticism, and you have the courage and the confidence to add that to, because regular medicine might be poo-pooing this incredibly, and there's such a rift between, it almost seems like dark and light, between the pursuit of power and money versus the pursuit of natural, safer, cheaper answers and embracing the spiritual path. So how is it that you have this courage to do this, and how did you go about finding out you had a guide? If other people want to see, does everybody have a guide? So that's another question, but
right, everybody has a personal angel.
Everybody has a personal angel?
Everybody has a personal angel. Your personal angel is there to coax you. I often think it's like the story of Pinocchio. The soul is the master controlling the robot, if you will, control the puppet. And if you pay attention to the soul messages, then everything is okay. Otherwise, you grow a big nose or something else. But then we also have teachers. So we all have at least a personal angel who's your conscious guide or subconscious if to some people, but at any rate, it's the conscious speaking to you. That's the personal angel. And that angel is with you from the day you're conceived until you pass on to the next life. And then it helps you get through that too. But your teachers are other guides. And my teacher is, my teacher. He inspires me. I don't always talk to him. Sometimes I just get the idea, and then later he and I may discuss it. But the important thing is paying attention to insight, to intuition. This is, again, intuition. It's part of life. And so I just happen to have been blessed in this life with wonderful parents. I never had a question. I was always, treated excessively nurtured as a child. And I don't regret that by any means. And I'm very grateful to my parents. And then, of course, the next best thing that happened to me in my life was meeting my wife.
You have pictures of your wife all over your institute, and I believe that she is buried right there on the property. At least there was like a grave.
Yes, the ashes have been put there with a marker. Yes,
there's a marker there. So when you pull into your parking lot around the institute where we had our training, the first thing you see is your wife's marker. And when you walk into your building, the first thing you see is a huge picture of your love of your life. And you mention her throughout the talk of how important she's been to you. She's not here in this body right now, but I was so impressed by your relationship with your wife.
Well, there are soul connections. There's no question about that. And Shealy was one of my most important soul connections in this life. We've had several before. My first one I know about was 2,000 years ago. We were married.
What about the people who feel like they are lost and the universe isn't supporting them and they don't hear any guides? They don't feel like they've got teachers helping them out. They feel like they're just getting one bad situation after another.
Now, I have created a system which we call Biogenics. Biogenics is a system of about 40 different mental, visual, and meditative exercises to help you regain control and management of your body, your mind, your emotions, and your connection with God and soul. And so if they will practice that, they can get there. There are 3 of those exercises which are superb for gaining control over pain, for instance. In fact, in 1976, I went to the Philippines and something happened. I got a sinus infection. Every sinus in my head was filled with pus. Finally, I had to have surgery. And I said to the anesthesiologist, give me 20 minutes and I'll be ready. So I made my nose numb mentally. And I said, okay, I'm ready. And they operated up through my nose, cutting bone to get into the sphenoid sinus, no pain, and they got it drained out without my having to be put to sleep. That's how much control you can gain if you practice.
And is this a program that people can purchase on your site?
Yes.
And what's the name of that program? Biogenesis?
Biogenics. Biogenics. CS.
CS. Biogenics.
Yes. And there are 40 of those different exercises. And that's what I developed that between 1972 and 1977. And it's just tremendous for gaining control over psychological, emotional problems as well as pain control.
So it's a program for emotional management.
Exactly. And pain control.
And pain control. So how does your belief in the universe, how does that sit next to the belief of Jesus and Christianity? And I know that Carolyn Meese, who's one of your main cohorts in life, had been a nun, had been a very active person in the church. So how does that, for the people who are sitting out there that are a member of this and that, how might you discuss that?
Well, I think that Jesus created the concept that we now call Christ consciousness. And so I'm totally attuned to the idea of the Christ consciousness, which is love, and help. That's what I think of it as.
I love that. I love that. You know, I lived for many years with Swami Satchidananda years ago, and there were people from all religions, and because we thought of it as a way of life, a way to be so mindful in action.
And he, by the way, was one of those gurus who had an aura this big.
Oh, he was amazing.
It is a big white aura with a gold outline around it.
So I got to live with him. I got to hang out with him for years. And when I saw him later on one time, he was speaking at a place in San Francisco. And by that time, when I was in the ashram, I had white robes or, Levi's when I was working out in the garden. When I saw him in San Francisco, I was all done up. I had tight pants and high heels. And he put me over his lap and he spanked me. He said, "You haven't kept in touch, and what have you done?" But
I only met him twice, but each time I was impressed with his aura.
So talk a little bit more about consciousness, because you talk to most physicians. You're a surgeon. What does that mean in consciousness, and how do you see the bigger picture of life when you talk about incarnations in life? Is this a path of always becoming more and more conscious? And if that's true, why does it seem like the world is always going to hell in a handbasket?
Well, unfortunately, it's because of the ignorance and the stupidity of those who are truly evil. There is an evil force. And there are people who, Lucifer was, I suppose, the beginning of this in ancient metaphysical history. Certain angels turned bad. And so there are people who, for whatever reason, follow darkness instead of light. Interestingly, for instance, you can be possessed by that negative energy. I've done 6 getting rid of demons in people. 6 times where I've found a demon. Instead of going into past life, I started, and all of a sudden I'm looking at fangs, and I see these etheric things. And the first one I saw, I was about to do a past life therapy session on a man as a demonstration for a group of students. And the next thing I know, I'm talking to a demon. And I said, "Oh, wow, isn't that interesting? I never had a chance to do this before. What fun." So finally, I got the demon to go to the light. And this man was out of his depression for the first time in 42 years.
That's really amazing. That's really, when I remember being young and feeling like I didn't believe there was darkness. It was just all good and it could be all good. And you have this idealism. And then as you move across your lifetime, you bump into true evil, and there is the force of dark and light. So how does the average person, because the world is marbled with these light and dark energies, how does the average person best protect themselves and deal with this?
They learn to detach. The single most important word in the entire language is detachment. For instance, to me, there are 2 serious evils: nuclear energy and chemical poison. I am not able to conceive of a way in which I can get rid of them. To me, they'd have to shoot every congressperson in this country and the leaders of all the countries in the world to get rid of nuclear energy. And yes, the most stupid thing humanity's ever done. Therefore, I detach. If I cannot change it, I will not squander my energy worrying about it. The same is true with Monsanto, who created Roundup.
Monsanto. Yeah. You're talking about the chemical company. Oh, you're calling. Oh, I see. I didn't catch that. I need another sip of coffee. Monsanto. Oh, my goodness. What a great term.
And Roundup is one of the most poisons in the world. And you can't get rid of it because 65% of the rain has it in it. And so they did a study in California, published just last year. 35% as much Roundup in organic wines as in non-organic wines, because even though the people raising organic wines do everything they can, the rain still comes out of the sky.
So does your product, Dr. Shealy's Youth Formula with the molybdenum in it and the combination of the MSM and the C, is that one way we can gently detox on a regular basis?
Yes.
How much of that should we be taking every day?
4.
4 of those, like 2
4
twice a
capsules.
day? Is that the optimal, or can you take 4 at
I
once?
take them all in the morning, actually, because vitamin C, it's going to last all day.
Okay. And is that a buffered C or a regular ascorbic acid? What is that in your product?
It's ascorbic acid. St. George, who discovered vitamin C, took 8,000 milligrams a day. And I met him when he was in his late 80s, or about 88 years of age.
You did? What was he
Yeah.
like? What was he like?
Oh, wonderful. Again, a genius.
Genius. Yeah. I bet you've met some really amazing people throughout your lifetime. But going back to how you met your guide, if people are, so I don't have a conversation that I know of with a guide, and I'm by myself. And a lot of times I feel alone, even though I feel strong on purpose and I love life and feel grateful for it. If I was going to go about trying to open up a communication pathway with my guide, what would I be doing, Norm?
Well, back in 1984, December of 84, I remember it well, I awoke at midnight, and I go to bed at 9 o'clock, and I don't wake up at midnight, but I did, and I was talking to 15 different guides. And I'm sitting there, I got up at my desk, and I'm trying to make notes with A, B, C, D, and I met my personal angel. And my personal angel is named Muriel. And your personal angel, by the way, is always of the opposite sex.
Really?
Oh, yeah. And
always of the opposite sex.
That's my understanding metaphysically. And so I talked to her for the first time then. And it was several years later, I said, I want to talk to you again. I hadn't heard her again, And all of a sudden, we had a 3-hour conversation.
And this is a conversation in your head, silently in your head.
I hear it.
You
I literally hear the words as if it was speaking into my ears.
So how does somebody initiate that relationship with those that you say are there, but they might not know it?
I just made a recording last Thursday of getting in touch with your personal angel. I've added to my Biogenics series.
Can we buy that separately, or we have to buy this?
It may not be up on the website yet, because we are, in addition to my guided imagery, all of my Biogenics guided imagery things now also have sound with them. And we're not only putting sound in, but we're putting gamma and other modulation to help the brain focus.
So in other words, in your series, there's sounds that help the brain focus.
It's all
music. You had us listen when we were at your course. You took us in all these different rooms. Some rooms were filled with crystals. Some rooms had that copper pyramid. Some rooms we had to put earphones on and listen to sounds. Then you took us through a past life. You had us observe you do a past life regression on one of the people, I think one of the nurses there taking the course, right?
Yes. But now all of them have this sound modulation, because last year I was at the Monroe. Oh, actually, time passes. I guess it was February of last year. I was at the Monroe Institute for one of their workshops.
What's the Monroe Institute?
Monroe Institute. Bob Monroe created hemisync and other ways of modulating sound to help focus the brain.
Okay. And
all of a sudden they played a piece with gamma modulation, and my whole body physically vibrated. I mean, in fact, you could feel, if I touched my bone with a finger, I could feel the bone vibrating with the music. So now gamma has become my favorite music.
So gamma is a wave.
Yes, it's 40 cycles per second.
So you've created music that helps create this wave inside us that helps relax the body and give you emotional, spiritual, and pain management.
Exactly.
Okay, I'm just trying to make sure that everybody understands everything that you're doing. I love that idea of detachment. I wanted to go back to that for 1 second. Swami Satchidananda used to always say, make no appointments and you'll have no disappointments.
I like that idea, yeah.
But
let me reach over here and get something. I want to show you this briefly.
Okay. This is really incredible. I still don't totally know how we can access our teachers, even though I've asked you that. So I'm going to belabor that point in a second.
See this little card?
Yeah. How am I feeling?
This is my philosophy. My dear, dear brother, whom I met 3 years ago, Sergei Sorin, took my philosophy and put it into this little card. There are 5 basic fears: life, fear of death, that is, fear of disability, fear of poverty, fear of abandonment or loss of love, or essentially fear that God is not with you. That's I call it the existential crisis. The 4 reactions to fear are anxiety, depression, anger, and guilt. Now, you can deal with those one of 3 ways. If you think you can beat it, fight it. Yeah, have fun. Go to battle. If you know you can't, divorce the blank with joy.
Divorce the blank? You mean the person who is the bad
Exactly.
seed in your life? Okay. Get away from that, which is not good.
Evil, in other words, with joy.
Okay.
And then go for sainthood. Accept and forgive. So be in present time. That the problem, most people live in the past. Be here now. So ask the question, how am I feeling? If I feel good, fine, I'm okay. Forget it. If I don't feel good, can I fix it by taking action? If yes, fine, take action. If not, divorce it. Accept, forgive. It's that simple.
I love that. You know, I wrote a book that I don't think I've sold very many of them, but it's a book in color and picture. And I showed Carolyn Meese these books, and it's called Juicy Souls, How We Give Our Spirits Away and How to Get Them Back. And it's all about how most people, and it's available on Amazon, it's about how most people live in the past or the future and how to get more present. And what you're saying is that the essence of it is detachment, and it's action. Get rid of the person or situation that's bothering you, and then also detach. And yet a lot of people are sitting out there going, well, that sounds easy, but I might know all that. I mean, even Sister Teresa, at times in her letters, she feared that God had abandoned her. She had one of those fears.
Well, that's the existential crisis. That is one of the big basic fears. That is, Saint John of the Cross, all of these people, the great mystics, recognize that ultimately you have to detach from those things you cannot change.
So you feel, what I can feel from you and what I felt from you at that week when we lived with you for a week, is that you do not embody any fear. You are
That is true.
You don't. And you can feel it when you meet a person who doesn't have agendas about only themselves and about fear.
That is true. I'm just here.
At a very, very high level. So I'm going to go back to the teacher again. If one was wanting to open up a line of communication, and then I'm going to stop it. This will be the last time I go here, with their teachers or their guide, does one sit down and just say, I really want to talk to you like you did?
Well, that's one way of doing it. That was one of my brat days. and I did. But, basically, if you can detach from your fears, then you're ready to receive.
Okay. So you have to have a certain level of mindfulness and consciousness to be able to open up that line of communication?
Absolutely. Now, if you don't have any of that, the single thing is one called autogenic training. That's the foundation. Basic Shealys.
Basic what?
SCHULTZ. Shealys is the guy who developed the technique called autogenic training. There are 22,000 scientific references on that particular exercise. My arms and legs are heavy and warm. My heart beats calm and regular. My breathing's free and easy. My abdomen is warm. My forehead is cool. My mind is quiet and still. Each of those phrases, repeated 20 to 25 times very slowly, puts you into an altered state of total hypothalamic autonomic balance. Doing that twice a day for 3 months will change everybody.
So what you're really saying is that life is a journey of service, but to enjoy this journey to the maximum, we need to know how to relax, to get
Exactly.
and let go of our fears. And yet we live in an era where we're run by fear. Everyone is in hyper warp speed of doingness. And then we've got a cultural addiction, especially in our children, with the phones. And so we have less connection and more anxiety and less relaxation, the opposite of what we ideally need.
That's why I do not have a dumb phone. I refuse to even own one. I have, for emergencies, an old-fashioned flip phone. It's never turned on unless I'm traveling and need it. The idea of being available on the phone 29 hours a day is utter nonsense to me. You should, being preoccupied with the phone, throw it away. It's dangerous to your brain and your health and your life.
So what do we do with our kids? Our kids are addicted to the phone.
Well, if it was my kids, they would never own anything other than a cell phone. Just a simple ability to call in emergency. Phones are for emergency. They're not for day-to-day thinking.
But that's not the reality of the culture. I have a nurse friend that I love, and she loves my cooking. I love to have her over for dinner. I literally have to take the phone away from her when she enters my home, or I can't have a conversation with her. She's almost 40. She'll just keep looking at that phone. It is a true addiction. And so what do you think this is going to do to us as a human race?
It's ruining us. It is, in my opinion, a total distraction from reality.
So what as a parent, might we do since kids don't want to live without a phone?
Well, they will live without a phone or they won't be my child. I would raise them. I mean, when my children were raised, for instance, they were allowed 4 hours of television a week. They were allowed 4 hours on Saturday or Sunday, or combined, to watch television. Interestingly, by the time they were juniors or seniors in high school, they didn't even use the 4 hours because they learned to live without that junk.
I know there's a book, I'm just trying to scroll through my mind of who wrote it. The picture on the cover is a baby in the light of a television, and it's called The De-Evolution of Humanity. Do you remember that book? And it even mentioned endocrine disruptors and television and birth as a surgical procedure, and it was all the ways that humanity was going down the wrong path.
And I, since the beginning, have said that television was the beginning of the destruction of humanity.
So do you watch TV in your own home?
Zero.
Interesting. So what are some of your newest exciting things? You were going to talk about this adrenal, so forth. You have new things coming down the pike, right, and we want to know about them.
Two of them. One is pulsed electromagnetic frequency, PEMF, and I created a PEMF device that sweeps the frequencies of the human chakras. So it's called the Shealy Soren PEMF, pulse electromagnetic
is
field. Is
Soren your partner?
Yes, he is a soul brother.
How do you spell Soren? It's a little bit difficult to hear. How do you spell that?
S-O-R-I-N.
S-O-R-I-N. Okay.
Yeah, I met him 3 years ago and knew him. And just as we were together with St. Francis of Assisi as brothers.
And who is he now? What is his background in this lifetime?
He came from Russia or Belarus. When he was 12, his family moved to this country, and he's a physician, and he is the brother I always wanted as a child.
Oh.
And so together we run the clinic now. And he keeps me. He's actually more intense than I am. But at any rate, the chakra sweep, for instance.
Can you explain what a chakra is for people who are out there going, chakra? What's a chakra? What's the
there's 7 energy centers in the body, and 6 of them are related unequivocally to the nervous system. The first chakra is the sciatic plexus. The second chakra is the pelvic plexus. Third chakra is the solar plexus. The fourth chakra is the heart center, or cardiac plexus. The fifth chakra is the cervical plexus. The sixth chakra is the brain itself, and the seventh chakra is the connection with soul. And each of these has a physical frequency as well as an etheric and other dimension frequencies. So we created the physical frequencies of the chakras, which came to me intuitively. And so we sweep through those every 10 minutes. Now, like for instance,
what do you mean we sweep through these every 10 minutes? What does that mean?
Well, so it starts with plus or minus 2 of the 7.8 is the basic frequency, plus or minus 2. So it starts at 5.83, and within 10 minutes it sweeps through 7.83, 8.83, and all the way up to 58.83.
You're saying we have electrical frequencies that sweep through these auric fields on a constant basis. Okay.
Very low intensity. But these are one of the greatest things for pain relief. Yesterday, I had a woman with a pain in her feet of almost 10 out of 10 on a 0 to 10 scale. I put these on her for only 20 minutes. It came down 50%. She's going to use it at home, of course, hours a day. But the most important part of this, by the way, and this is to me the most exciting part, if we put this on your head, and we do, it puts the brain into gamma. Woohoo! In the zone. And
that's the energy you were talking about earlier, that you're into gamma.
Exactly. And we are now treating 12 serious narcotic addicts successfully with gamma frequency from our PMF.
So is this a machine that you put little electrodes on somebody? What does it look like?
You want to see it?
Yeah, I want to see it. Everybody wants to see it. Mind you, we are getting to really have a dialogue. You're getting in on a conversation with someone who made pain management what it is today, other than surgical interventions, and has consistently made patents and inventions all his life, and now is given the bigger picture and has a baseball cap on. There you go. Oh, that's what it looks like. It's a ring.
Yes, it's a ring. The patients call it their halo. And this is for narcotic addiction, depression, and actually this lowers blood pressure significantly, as other things too.
And does someone have to go see you to get this, or do you sell this on your store?
It's on my website.
And the name of it is your PEMF.
Yes, Shealy, Soren, Chakra Suite, PEMF.
So what does the regular medical profession think about this, about what you're discussing?
The medical profession is still in the dark ages.
Why is that? Why is it so in the dark ages, Norm?
They've been brainwashed by the pharmacomafia. The part of the evil empire is the pharmaceutical industry.
And the patient loses out. The patient loses out. Yeah. And they're totally fearful of alternative ways. They should be more fearful of the pharmaceutical ways, but it's a cult that has successfully brainwashed so many.
In acute illness, drugs can sometimes be useful. In chronic illness, they're always dangerous. I do not know a chronic disease for which I would take a drug.
So this is the Shealy Soren pulse electromagnetic frequency halo. You could just say halo.
Right, exactly. That's what it is.
And how long does the patient wear that for?
A minimum an hour a day. You can do it. You can put it under your mattress. It'll go through the mattress. And
it puts the brain into gamma wave.
Exactly.
And the gamma wave gets the brain into harmony and a relaxing safety state.
Right.
So, and then you said there was another invention. That was one.
Sapphire enhanced adrenoscaler. This alone is the single greatest stress reducer in history. We have demonstrated that it just exposure to this 1 hour a day reduces adrenomedullin. Adrenomedullin is another hormone. It is the ultimate stress hormone. It is more important than cortisone as a dangerous. It comes in, it's produced all over the body in blood vessels. So if you get trauma here, the blood vessels there will reduce adrenomedullin to bring it back down.
Can you spell adrenomedullin? How do you spell that?
ADRENOMEDULLIN. And a study in Italy a year and a half ago demonstrated that there's a place in southwestern Italy where people live longer than any other place in the world. And I intuited that the reason they do is the topography of that area somehow focuses scalar energy. All empty space throughout the entire universe is filled with scalar.
What's scalar mean?
SCALAR. It is 0 point energy. It really is God. It is the power of God, in my opinion, because it fills every space. According to Bill Tiller, a physicist, there's enough energy in a piece of this empty space the size of a helium molecule to boil the ocean. If you focus it,
so it's power. It
balances all the electromagnetic negativity, and it reduces adrenomedullin. It reduces free radicals 40%. It reduces inflammation in the body by 80%. And we are now using it to regrow telomeres.
So is this a square that you stand on, put under your mattress?
No,
what do you do with that?
You just have to be within a few feet of it.
You just have to have it in your office or your home?
I've got it in my office and in my bedroom.
Now, do you sell that on your site?
Yep. Now I have to say all of these, for your information, since we met, I have become a certified Native American medicine man in the Nemenhah Native American Church, because philosophically, to me, just as I consider scalar God energy, everything in nature is God energy. Everything created by is God energy. And I really like the Native American philosophy. So all of these are sacraments of the Native American Church. My bliss oils, the scalar, the PEMF, they have been made sacred instruments.
I really love what you're talking about, because you come with what people say. I remember I went out on a date once with this guy and I said, well, who are you? And he said, I have impeccable credentials, his major university background. And you have really impeccable credentials. And I also remember going out on a date once with a guy, and I told him that the person we'd met had great energy. And this is years ago. And he was a photographer for the space shuttle, very straight kind of guy. And he said, energy, what are you talking about? Energy. God, energy is physics, nothing to do with life. But you have taken with your impeccable credentials life to another understanding and given us tools. And you've proven it in wings of hospitals and clinics and classes. And I'm going to want to talk for a second on the PhD program that you had mentioned when I was there, and I'm not sure what's going on with it. But you have created in your genius way tools with which to tap into healing from that which you studied from your impeccable credentials on this level that everybody can do, and that can bring more harmony, and that looks at a bigger picture with no shame and with total bravado. I'm in awe of you, Norm. I really am. And I was so excited to be able to spend this time with you and to share you with my tribe. When we were in Missouri at your course, you mentioned that you were donating massive amounts of money to a college if they did this PhD program and added spirituality and nutrition to it. Did that come to pass?
Oh, yes. A wonderful young lady. I think she's 37 now. She's been here a couple of years. She is a ball of fire. She has 18 research projects going on right now. I created the Mary Charlotte Bayless Shealy Chair in Conscientious Psychology.
Conscientious Psychology, that's what the program you wanted. If you said you would donate this money if they would name it that and incorporate those things.
And so the university now owns the farm as well as endowed the chair, so that I live on the farm. I have my house and my office out there, but I don't have to worry about the farm.
It's about 300 acres, right? Was it
256?
256. I knew it was something like that. And you've donated that to the school to manifest this dream come true of a higher consciousness and of a way of healing and addressing people's suffering and getting people whole and well.
Exactly, as well as the chair of conscientious psychology.
So explain what that means as a chair. So this person...
That means her title is to work just in that field, that part of psychology. Conscientiousness is the single most important mental trait. It is organized and responsible, organized and responsible, organized and responsible. And the question is how to teach people how to become conscientious, because most people don't have enough of it. It is a deficiency in humanity.
I'm so glad that the conversation came to this point. I've been so lucky that one of my very best friends on this planet is like a soulmate, my best girlfriend, who is one of the most conscious, mindful people I've ever met. So I've learned unconditional love from her. I continue to learn from her. And she and I, when we chat, talk about how being present, being here, to us is one of the most important qualities. And yet, so I'm still dating, and often I'll be opposite a guy at a dinner table on a first date, and I could tell in a nanosecond they're not present in themselves at all. And most people don't know how to be present. And to me, I hold that so high, and yet there's so few people that do that. And I think that's what you're talking about with conscientiousness.
Exactly.
So you want to help develop this program where people learn to focus and help other people create this and live it, right? That's what this program is.
Absolutely what it's about.
What a gift. What a gift. So it's going to be it's a 4-year PhD program.
No, it's actually just, it's taught to undergraduate students now.
Oh, okay.
And the research is to develop programs that can be used in all parts of life to help enhance conscientiousness.
Like all the different inventions that you're sharing with us today that people can purchase on your site.
As a matter of fact, right now she's using our PIMF device to see if just using that will increase conscientiousness.
Well, we're going to have to maybe get Match.com to use these devices. So if somebody wanted, you said you trained a number of really noteworthy medical intuitives. Are you open at all still to take somebody on, to train someone to become a medical intuitive? If I wanted to come and hang out with you and develop this?
Actually, I'm starting an online course in June.
Really?
On what I call health intuition. That to me is the foundation. And if you go through the health intuition course successfully, then I will do a course on medical intuition. But I think you need to begin with getting yourself healthy and intuiting where your hangups are and all of that stuff. And then you're ready to intuit other people.
I love that. So is it going to be like a 5 or 6 week course or several month course?
It's a 6-week online course, but actually it's 12 weeks. Every 2 weeks is the webinar.
Okay, so it's 6 webinars over a 12-week time. And is that going to be on your website? So if someone wants to purchase your health intuition.
Yes, intuitive health or health intuition, I forget one of those. And yeah, it's on the website.
Okay. You just continue to keep giving, continue to keep exploring, continue to be a person. It's so wonderful to talk with someone that you can feel that they're not Velcroed to agenda and ego, but really to service. And you have this light. You had this light the whole entire 40 hours. It never dimmed. And it's an honor to speak with you today. And coming to a conclusion of our chat, is there anything that you want to say? This has been so much fun. I really want to hop a plane and fly out there and shadow you and bug you.
I think the single most important thing is to recognize if you have harmed someone, you need to make retribution. In other words, if you raped, robbed, hurt, killed, harmed someone purposefully, you need to be guilty. Then you need to resolve your guilt. But if you haven't done those things, you're okay. That's the basic foundation for being okay, is not to harm other people. Then you can look in the mirror and say, I'm okay because God does not create junk.
What about if you have been really harmed by somebody, especially somebody you loved? What about this whole forgiveness thing? I have someone I'm thinking about in my own life right now.
There we go back to this. Forgive the bastards.
But it doesn't mean you need to have them in your life actively.
Oh, no. You can divorce them. Divorce them with joy.
Divorce them with joy. Thank you so much for being on the show today. We're going to have great show notes, and we're going to summarize all of the different wonderful gifts and inventions that your genius has created, and people can pick and choose what they want to purchase. I myself am going to have to take another second out on my home to purchase them all. I want them all. And most of all, thank you so much for what you've given to this planet and your perception. It's always such a gift to have a person that comes from such a high level of mindfulness on the planet today. It brings all of us up just by getting in on this conversation.
Well, thank you for making it possible.
Okay, blessings your way, Noah. I love you. Blessings. Bye-bye. Everybody, what a gift. Take care. Go to those show notes. Blessings, everyone. Bye.